Hello everyone, this is my presentation on addressing alcoholic liver disease among the Navajo Nation, a vulnerable population that I have identified. During this presentation, we will discuss what makes the Navajo Nation a vulnerable population, specifically those that suffer from alcohol use disorder, and we will also propose a plan to address this vulnerability. In this presentation, a few terms that we may encounter often include AIAN, which represents American Indians and Alaska Natives, AUD that represents alcohol use disorder, NN for Navajo Nation, as well as ALD for alcoholic liver disease. So the Navajo Nation is about 27,000 square miles in size and covers parts of Arizona, Utah, and New Mexico. It is the largest Indian reservation in the United States geographically and comparable to the size of West Virginia as a state. Also, the Navajo Nation is bigger than New Hampshire, Vermont, and Massachusetts combined. So some more facts about the Navajo Nation. They kind of operate as a country within the United States, and they have an elected president and also a tribal council. Now, it is important to note that they are also U.S. citizens and still follow U.S. federal law. The Navajos speak Navajo as a language. It is a very complex, in fact, it's so complicated of a language that Navajo soldiers used it as a secret code during World War II. And apparently it was very crucial in the victory of the United States Army. According to the IHS, Native Americans face lots of health disparities, which include cancer, heart disease, diabetes, alcohol and substance abuse, kidney failure, and chronic liver disease. The U.S. Preventive Services Task Force estimates that about 14.7% of Native Americans are at risk for diabetes, that the rate of alcohol use among Native Americans is 54.3%, higher than all other ethnic groups. They estimate that 76.7% of Native Americans were identified as overweight or obese. They also say that 1 in every 6 Native American between the ages of 12 and 17 have engaged in underage drinking, and that Native Americans were 1.6 times more likely to be diagnosed with liver disease. A study done by Utah State University estimated that chronic drinking among Native Americans was nearly 3 times higher than all other populations, and that 102 Native American deaths per 100,000 were attributed to alcohol-related chronic diseases as compared to only 21 deaths per 100,000 in non-Hispanic whites. The Navajo Nation faces their own disparities as well. It is estimated that 30% of Navajo homes do not have running water, and about 15,000 in 55,000 homes do not have electricity. There's no doubt that the Navajo Nation suffer from alcohol use disorder and alcoholic liver disease, which eventually leads to increased mortality rates among this population. And so to solve this problem, we have identified some prevention measures that can be undertaken. Primarily, educational programs could be set up to teach the Navajo people about abstinence from alcohol. And also legislation could be put in place to ban the sale of alcohol. In fact, according to Title 17, Subchapter 12 of the Navajo Nation Code, the transportation, sale, and consumption of alcoholic beverages is prohibited on the Navajo reservation except for authorized casino establishments. As a secondary measure, audit tools could be used in conducting frequent screenings, and also wellness checks could be done for people who may be at higher risk for alcohol use disorder so that they receive early crisis response and intervention measures. As a tertiary prevention measure, those who suffer very badly from alcohol use disorder could be referred for medical management, and also they could be put in support groups like Alcoholic Anonymous. So our clinical question in PICO format states that among the Navajo Nation, how do educational programs compared with regular wellness checks reduce the mortality rate related to alcoholic liver disease in a 12-month period? So in an effort to battle alcohol abuse disorder and all its complications among the Navajo Nation, a project was designed to take over a period of 12 months and to undergo 3 distinct stages. The first stage being the design and preparation stage, and during the second stage, the plan of the project will be implemented, and during the third stage, the results of this plan or project will be evaluated. To ensure successful implementation of this project, we will partner with the Navajo Nation Division of Behavioral and Mental Health Services, DBMHS, and Navajo Strong, which is a nonprofit organization that has addiction treatment centers all over the reservation and perform frequent crisis response interventions. These two organizations have been on the Navajo reservation for a long period of time, and they have experience in dealing with the Navajo people and actually have results from interventions that they've been able to do to help the Navajo people. Other key stakeholders will be the project manager, who will actually be a rep from the Navajo DBMHS. Would have a researcher, 2 RNs, one of which will be the DNP student. Would have a physician for medical management in treatment centers, and also a social worker. As mentioned earlier, this project is going to take a total of 12 months. In the first 2 months, we will design and prepare this project and also have a draft to make sure that our team members are familiar with what's at hand. So the social worker, the RNs, the project manager, the researcher would have potential site visits even to make sure that everyone understands what they're supposed to do and the roles are clearly spelled out. We would also engage with tribal and spiritual leaders of the land to make sure that we're developing the trust of the people, because as we know, we may be seen as outsiders, invading someone's land. We'd also partner with the IHS, Human Resource Department, to make sure that we get a good orientation and learn about the Navajo people, their norms, their values, to make sure that we're providing culturally appropriate and sensitive care. We will begin our intervention stage at the 3rd month, and this will start with a pilot study or pilot test of potential participants, just to get our initial lessons learned and to get reactions of the participants, which we'll then inculcate into our actual intervention. And that would have an actual enrollment of participants into 2 groups. So the first group Yet would have educational programs in the form of alcohol use disorder handouts, flyers, and also weekly 30-minute sessions of education. And the second group Akiehe, will have audit screenings done also on a weekly basis. So both of the interventions will be performed by the registered nurses and the social workers. So educational programs, will be taught by the RNs, and the audit screenings will be performed by the RNs and the social workers as well. This will go on until the 6th month mark. At the end of the 6 months, our researcher will come in and collect data in the form of surveys that were created and also pre-tests that were administered as compared to mid-intervention tests that will be administered as well. We will then seek feedback from all our project team and also compile this data that we have and analyze it to be able to make improvements, because this intervention will be going on until the 9th month when we will begin the evaluation stage. So these interventions will go on through the 9th, 10th, and 11th months, and during these months we will have analysis of the interventions being done also, and it will be anticipated that Group Yat, who received educational programs, will have a drastic reduction in alcohol consumption as compared to Group Akiehe, who only got audit screenings. So eventually at the end of the 12th month, we would have our end of intervention survey and compile all the data. The researcher will analyze all this data and come up with our final report of our analysis or our interventions. And so these findings will be shared with our community members, of course. We'll share them with our policymakers. We'll also share them with nonprofits working on the Navajo Nation and also our funding partners. So at the end of this project, we'd hope for a slow but sure change in mechanism as evidenced by decrease in alcohol consumption and improved health conscience related to alcohol use among the Navajo people, to eventually lead to our outcome of decreased mortality related to alcoholic liver disease among the Navajo Nation. And none of this would be possible without the diverse backgrounds and experience that our stakeholders, bring to the table. A SWOT analysis that was conducted on this project revealed that, again, our team members were our strongest assets because they have diverse backgrounds and represent rich experiences that contribute to the success of this project. This effort is also heavily funded, and so we're financially stable and able to, very well compensate our team members. One weakness that we can realize from this project is the outsider syndrome, which is directly mitigated by the opportunities as well, because we have tribal and spiritual leaders' involvement, and with that, we hope to build the trust of the people and not be seen as outsiders. We're also engaged in nonprofit organizations that have experience working with the Navajo people. One threat or some threats that may arise from this project will be the cheap price of alcohol. Loss to follow up because some of our participants may just fall off and not engage fully to the end of the project, and also a language barrier that could be seen. To mitigate these threats, we will partner with policymakers to ensure that we're enacting policies that increase the prices of alcohol, not just on the reservation, but in neighboring towns like Farmington, New Mexico, Shiprock, New Mexico, in efforts of making alcohol not easily accessible to the Navajo people. We would also offer cash and kind incentives to our participants to make sure that they move on with the project all the way to the end. And in partnering with our tribal and spiritual leaders of the land, we're hoping to have translators and people that will connect with our team and make sure that the language and cultural barriers are bridged. To ensure successful implementation of our interventions, I would have our researcher analyze all this data in the forms of surveys, pre-tests, post-tests, even pilot recruitments of potential clients to be able to get our initial lessons learned as mentioned earlier. We would also seek the feedback of the entire team at the 6-month mark to be able to have data that we can analyze and learn from as we continue to implement the project until the end. And at the end of the project, we'd have our end of intervention survey and analysis of end of intervention data. DNP Essential 4 by the American Association of Colleges of Nursing explains that a DNP prepared clinician is equipped with knowledge geared towards utilizing information technology to garner quality improvement measures and ultimately provide excellent delivery of healthcare services. And so this project will benefit from information technology, specifically through the utilization of telemedicine or telehealth, which will provide remote access to treatment services for Navajo Nation members who cannot leave the reservation or have access to specialized medical care. It would also enable timely referrals to be carried out for people who need medical care as a result of alcohol abuse disorder. It would also allow for early crisis interventions to be appropriately administered. So in conclusion, this 12-month project aims to utilize educational programs and the audit screening tool in hopes of reducing alcohol consumption, creating health awareness, and also reducing mortality rates specifically related to alcoholic liver disease among the Navajo Nation. It is imperative that more research is conducted on this topic, which would thereby eliminate alcoholic liver disease and alcohol use disorder as a major contributor to decreased life expectancy in Native Americans, especially the Navajo people. And so with the implementation of this project, it is my hope that conversation is generated about alcoholic use disorder and alcoholic liver disease as a major contributor to health disparities, and then it marks the beginning of sustainable change leading to improved health outcomes in Native Americans.